can see, but yeah, so it's something that we're working on. And my abstract for this research was recently accepted. I'll be presenting something during this international conference. So once again, thank you so much to the organizing committee. I hope you guys took 1 or 2 points from this presentation, and all the best. Thank you.
Wow, thank you very much, Dr. Mtele, for that presentation, reminding us that really the mouth isn't just about, chewing or we have a tooth cavity, and it's it's not just limited to that. You have shown us or reminded us that how just from simple, which I think from now we can understand that a cavity isn't something simple, but just from something like that, we can actually end up having heart issues, things that are really serious. So thank you very much once again, Dr. Mtale, for that presentation. And you're most welcome. And so we are going to look at a topic that is also very important. I will just ask that we mute our mics when we join. Well, I'll be muting as well. And before we move on to the next speaker, I'd just like to remind us that we are going to have a question and answer session at the end of all the 6 speakers. So do note down certain questions that you may have relating to the different topics, and then we are going to try and answer them together, debunk certain myths here and there so that we can learn and stay healthy together. So we are going to move on to yet another powerful doctor to address us with a very important subject, which is substance abuse and the improper use of medication. Ladies and gentlemen, this session will be led by Dr. Kahangu Prince, who is a pharmacist doctor and also a pharmaceutical engineer. Dr. Kahangu, we're eager to learn from your expertise. Please come on.
I would like to thank the organizing team for this opportunity to be able to share one or few things with you. Let me just share my screen. Oh, sorry. Hope it's visible enough.
Yes, it is. Please go ahead.
Okay. So we're going to talk about dangers of improper use of medication and substance abuse. So without further ado, I would like to dive deep into the facts about this subject, which is the reason why we're talking about it today. So just for information's sake, improper use of medicine and substance abuse are one of the major public health issues today. And the World Health Organization estimates that about 15.3 million, there are about 3.3 million drug disorders in the world as of now. And alcohol, just as a substance, results in 3.3 million deaths per year, which is quite a big number. And over 200 diseases and injuries are related to the misuse of substances and drug misuse. So to be able to define medication misuse, we have to refer to medical prescriptions. So okay, let me just put it this way. Medication misuse is simply taking of a drug without a medical prescription, or taking a drug for effects rather than the pharmacotherapeutic effects, which in most cases are the side effects, or taking higher doses of a drug, or rather taking drugs at intervals that are not recommended. It could also be the mixing of substances that are not recommended. And on the other hand, substance abuse is simply the harmful use of any legal or illegal substance for mood-altering purposes. So some of the commonly used substances and medicines is we can find alcohol, cocaine, opioids, benzodiazepines, cannabis, barbiturates, amphetamines, hallucinogens, inhalants, and club drugs. So to look at them individually and their risks, for the sake of time, we'll just look at the major risks that they pose and not the reasons or the motives why people take them. So for alcohol, we all know, like in most cases, we find beer, wine, spirits, and all kinds. So some of the major risks that are involved are liver damage. We've all heard about liver cirrhosis. There's addiction, there's impaired judgment, accidents, and withdrawal risks. And then we have cocaine, which is also one of the most consumed substances. This can lead to heart attack, stroke, paranoia, addiction, and so on and so forth. And then we have inhalants. The most used substances are nitrous oxide and glue. So these could lead to brain damage, suffocation, and heart failure. And then we have cannabis, the most common known as marijuana or hashish. This can provoke impaired memory, anxiety, and psychosis. Psychosis simply means madness, especially in individuals that are vulnerable or that have rather a weak defense mechanism, if I may say. And then we have hallucinogens. In this class, we find LSD and DMT. LSD is lysergic acid diethylamide. This is one of the substances that is um, labeled as a drug that can cause someone to go mad as compared to cannabis. So this can provoke madness and aggressiveness. And then we have club drugs like GHB, sorry, which is used as a rape drug. And then we have ketamine, then we have MDMA, ecstasy, which is usually found in the US. So this can cause dehydration, overdose, and memory loss. So these are just non-medical substances that people consume on a day-to-day basis. And then we have medicinal substances that are also misused, such as barbiturates. These are drugs that are used as anti-epileptic drugs and what's this? Anesthetic drugs. And in most cases, the risk is respiratory depression. Then we also have opioids like morphine, oxycodone, heroin. People use them as pain relievers, to, in certain cases, for euphoria, just to feel good, to have fun. And the major risk is still respiratory depression. There's also dependency and tolerance. And then we have amphetamines. The most commonly consumed drug is meth. We've all heard about meth. For those who have seen the series Breaking Bad, that's the drug that they were making. It's methamphetamine, which is simply known as meth. So one of the medical effects is that it stimulates the central nervous system, and people use it to increase their alertness, to boost their central nervous system. But in most cases, it can lead to heart issues, paranoia, addiction, and aggression or aggressiveness. And then there are steroids such as nandrolone. I think it doesn't exist in Africa, if I'm not mistaken, but we can find it in countries like the US or the most developed countries. This is a synthetic testosterone, so it's a hormone which is used in bodybuilding. And one of the major risks, we're actually talking about this, we have to differentiate the risks because there are risks that are related to men and women. So for men, we have testicular atrophy. This is when the testicles become like really small. And then we have oligospermia, like reduced sperm count. Then we have erectile dysfunction, like having issues with, erections. And then we have priapism. This is like a chronic and painful erection. And then in women, it can cause hirsutism, This is like the growth of hair in areas where it's not supposed to grow. And male alopecia, it's just male kind of baldness, and cryptomegaly, which is the enlarging of the clitoris. And then we have benzodiazepines. This is a class of drugs that act on the central nervous system. People use them as anxiety relievers and to help them to sleep. But it's also one of the, I think, substances that can lead to dependence, withdrawal, seizures, and no, there's not supposed to be seizures. It's just withdrawal symptoms, if I have to say, and then overdose, especially with alcohol. So the stages of drug misuse or substance abuse can go from just an initial use, regular use, tolerance, dependence, and addiction. From the time somebody uses the substance to the level where they become tolerant, it's like they have to take more doses of the same substance in order to be able to feel the normal effect that they feel. So that means they are going to progressively increase in whatever substance they take. And then dependence is like they start craving, they become anxious when they can't take the drug. So it's more like oxygen. We all depend on oxygen. So they feel the same if they don't take the drug. And then we have the waste, which is addiction, which is simply the inability to actually control um, the the urge to be able to take the substance. Like the person, it's like the drug or the substance has taken over the person and they can't just control themselves. And other impacts apart from health impacts, drug and substance abuse can lead to issues in relationships, family-wise, social isolation, and so on and so forth. It could also affect work, studies, and so on. It can provoke financial issues such as debts and money problems, as well as legal issues. I would just like to talk about a few anecdotes um, about some people that we might know. So the thing about drugs is that one of the reasons why people use them is because they do not know how to actually use them, or in most cases they do not even read the notice that is found or that goes with the drugs. So for a class like democorticoids, these are just creams that we put on the body for allergic reactions, for example. The thing is, the more you apply it, the more the side effects increase and the more the drug efficiency reduces. So these anecdotes are things that I've personally known, or some people that I have known, or stories that I have heard. So somebody did this instead of respecting the prescription, they decided to rub as much quantity as they wanted, and they ended up having skin eruptions. And then we have propofol. This is the drug substance that killed Michael Jackson. It's like an oily and water substance mixture, which should not be administered directly in the blood. Of course, he didn't know, so he did that, and it provoked embolism, and he died. And then there's alcohol plus codeine. Alcohol on its own, it causes respiratory depression, plus codeine, which has the same effect. This is a story of somebody I heard in Morocco. Of course, the person died. And then there's alcohol withdrawal. This is somebody that I knew that fainted but later on survived. They were suffering from what we call delirium tremens. People that are addicted to alcohol, when they not decide, if they don't take at their normal interval, they start trembling, they start shaking, they can have nausea, headaches, and stuff, and leading to fainting. But fortunately for this person, he survived. And then we have cocaine, which can lead to heart issues, and that's what killed Whitney Houston. For some of you who know Whitney Houston, she had a heart attack from the cocaine, which led to atherosclerosis, and she died. And then we have amphetamines. These are drugs, like I said, that stimulate the brain. People use them to be more intelligent, to be more smart. somebody was disqualified in sort of a seminar just because of taking amphetamines. So to conclude, some of the best practices that we can adopt in order to prevent this is to follow prescriptions carefully, especially doses, intervals, and durations, and not to use medications that are not for us, for other people. And we should always consult with doctors and pharmacists whenever we have to have a new prescription in order for them to optimize the treatment. And we should always store medicines carefully, especially out of reach of children. And we should seek help if we know somebody or if ourselves we are suffering from tolerance, dependence, or addiction. And for legally accepted substances, it's better to consume them responsibly. And thank you for your attention.
Thank you very much, Dr. Kahangu, for that presentation. This is something that really affects the youth of today, substance abuse, misuse of drugs. And, even as we are learning about these things, I think if we know people who are actually, going down the route of drug abuse, you've seen the presentation, it might lead to dependency and it extends. It's a whole lot of problems. It will lead to financial issues and everything. I think we need to be ambassadors for our friends, talk to them, find them help, and let us avoid to go into, this spiral, because as you have seen in the conclusion, this actually leads to death. It's not just about, drug abuse like cocaine, even just some of these medications that are prescribed, if used in a wrong way, it really has side effects that are really dire and things that we need to look at. So thank you very much for that presentation. At this point in time, I have been informed that our first speaker is finally in. So I am quickly going to invite Dr. Lloyd Kwibisa, who is actually going to present to us something that we need, as students especially. We neglect this thing because of how busy we seem to be. We do not have time in terms of our diet and eating. We just mainly eat junk food because, after all, it's the cheap stuff. But ladies and gentlemen, the person who's going to present this topic on nutrition and healthy living is Dr. Kwibisa Royd, an alumni of the great Sidi Mohammed bin Abdullah University, the Faculty of Medicine here in Fez. He graduated in July 2024, and he is currently doing his medical internship at the University Teaching Hospital in Lusaka, Zambia. And he is also a dedicated medical doctor whose passion for preventive health care continues to inspire positive lifestyle changes. Dr. Kwibisa.
Thank you very much, Mr. Kennedy. And greetings to you all speakers and the audience. And my apologies for opening that is so nutrition health living, which as Kennedy stated is a very important topic, especially for students generally. It's an so so
Okay, I'll just help him with sharing the presentation. Just give me a moment.
hello.
I'm just having a slight technical issue, so I think while I sort this out, is it okay if we go to the next speaker and then You'll come in just right after?
Okay, no problem.
All right, fantastic. And just a reminder to everybody here today, we are going to have a Q&A session, so please take note of those questions that you may have. Anything relating to these topics, this is your chance to, ask. If you have any medical related question relating to this, we have a panel of professionals who are here who can actually help us answer those things. So quickly, we are going to move on to our speaker who is going to talk about another very important topic among the youth. This topic is actually sexual and reproductive health. And so we are going to hear from Chiangi Kondwani, who is a fifth year medical student, who is actually going to talk to us and share what he has prepared for us. Kondwani, please go ahead.
Thank you so much, Mr. Speaker. Please just confirm if you can hear me clearly and if you can see my screen.
You are loud and clear and we can see the screen. The screen is visible. Can you hear us?
Yes, I can get you. Can you get me now?
Yes, now we can get you.
Okay, thank you so much. Greetings, ladies and gentlemen, and welcome to the topic discussion about sexual and reproductive health, some steps to a healthier life. Now, this presentation will cover key topics on sexual and reproductive health, including its definition, its importance, key issues, and practical do's and don'ts about sexual and reproductive health. So let's dive straight into the first section. Now, let us imagine a world where every person enjoys a safe, respectful, and fulfilling sexual and reproductive life. That is the goal of sexual and reproductive health, ensuring total well-being, not just the absence of disease, but in all matters of sexuality and reproduction. And when we think about it, decisions about sex, about relationships, and about our health, it affects each and every one of us. So when people understand sexual and reproductive health, we see fewer teenage pregnancies, lower HIV rates, and more confident and informed individuals. Now, what exactly are we talking about when we say sexual and reproductive health, SRH? Now, according to the World Health Organization, sexual and reproductive health has been defined as a state of complete physical, mental, and social well-being in all matters relating to the reproductive system. It implies that people are able to have a satisfying and safe sex life, the capacity to reproduce, and also the freedom for them to decide when, if, and how often they're going to reproduce. Now, the components of sexual and reproductive health can be categorized into four key pillars. The first one is sexual health. Sexual health focuses on safe sexual experiences, a type of sex that is free of cohesion and that is free of violence. The second pillar talks about reproductive health, which involves care during pregnancy, childbirth, and also postnatal period. The third pillar talks about menstrual health and hygiene. It involves access to clean sanitary products, privacy, and correct information concerning periods and menstrual care. And last but not the least, access to sexual and reproductive health services such as clinics, counseling, and access to contraceptives, because everyone in the world, each and every one of us deserves affordable and respectful healthcare. Now, why is sexual and reproductive health so important at this time of the world? It is fundamental to individual health, to development, and to well-being. It contributes to reducing maternal and infant mortality, preventing STI, sexually transmitted infections, and also improving the quality of life. But it is also particularly important for young people, as students, because we're often at high risk due to a lack of access to information and services. And so when we address sexual and reproductive health topics, we equip ourselves to make more informed decisions, to avoid unwanted pregnancies, and also to protect ourselves from sexually transmitted infections. Now, what are some of the key issues or key problems that we find in sexual and reproductive health? As you may imagine, the first problem is sexually transmitted infections, and adolescents and young adults are especially vulnerable to STIs due to limited knowledge, as we had said, about how these infections are transmitted and how they can be prevented. And what contributes even more is that there is stigma and fear which prevent these young people from seeking timely medical advice or from using protection during sexual activity. What also contributes, or what another issue or problem that is in sexual and reproductive health, there are myths and misconceptions about contraceptives. Myths such as contraceptives cause permanent infertility or they promote promiscuity. These may hinder their effective use, especially among young people. And this misinformation can contribute to high rates of unintended pregnancies. The third point we're going to discuss, third issue, is teenage pregnancies. Teenage pregnancies remain a significant concern, particularly in low-resource settings, and young girls who become pregnant often face serious consequences, such as them being forced to leave school, undergoing unsafe abortions, experiencing life-threatening complications during childbirth due to their underdeveloped bodies. And due to time, I'll not talk about the other issues, but let us just know about them. These issues include unsafe abortions. Gender-based violence is also a big issue in sexual and reproductive health. And last but not the least, lack of comprehensive sexuality education. And so, just up to this point, we have talked about what sexual and reproductive health is, what are the components, why it is important, and the key issues or the problems that are in sexual and reproductive health. Now, what are some things that we can do or we can practice in order to promote sexual and reproductive health? Some of the do's, things that we can do. The first point rather, let us seek accurate information. Let's educate ourselves from reliable sources about sexual and reproductive health topics. Some of the information we can get come from the World Health Organization articles or non-governmental organizations that operate around the world, but more specifically in our context as Zambians in Zambia. The second point, if you are a youth who is sexually active, use protection. Consistently use condoms or other contraceptives in order to prevent sexually transmitted infections and unintended pregnancies. Another important point is to do regular health checkups, especially if you are a sexually active youth. Undergo these rather regular screenings for STIs and other reproductive health issues. The reason why this is important is if you're sexually active, sometimes you may have an STI, but it's not manifesting itself right there and then. It might be symptomless. So you need to do these regular health checkups in order for them to detect this disease that you may have at an early stage rather. And last but not the least, let us spread the word about sexual and reproductive health with our partners, with our healthcare providers, our doctors, and our trusted individuals. Not forgetting also those whom we live with, such as our friends, as well as our families. What are some don'ts, things that we shouldn't do? Let us avoid myths, spreading unverified information, cultural myths regarding sexual and reproductive health can be very damaging to the population. The second point, let us not neglect symptoms. When you have a symptom, especially if you're sexually active, seek medical advice promptly. The third point, don't engage in unprotected sex. Avoid unprotected sexual activities that increase the risk of sexual transmitted infections and unintended pregnancies. And last but not the least, something that many people don't take into consideration is consent. Don't ignore boundaries or consent that a person sets in relation to sexual activity. You need to respect someone's boundaries that they have set, which are clear, if you are to promote a better sexual and reproductive health. Now, ladies and gentlemen, now that we have understood what sexual and reproductive health is, why it matters, it is time for us to take action. Change starts with each and every one of us in our schools, in our homes, our student communities, like here in ZASAM. The next steps that we're going to discuss, they are simple, but they are powerful ways we can all help each other to spread sexual and reproductive health information in a safer, smarter, and stigma-free way. The first point, let us use our voice. Let us go viral with the right information. Let us use platforms such as Facebook, Instagram, TikTok to spread real facts, to abash myths, and to encourage others to take charge of their health, because awareness starts with each and every one of us. The second point is linked to the first. Let us break the silence. Let us initiate dialogue among us. Let us start talking about these important issues. Let's normalize conversations about our bodies, about love, about relationships, about health. Whether it's with our friends, families, partners, let us speak up. What is important is if we have knowledge about these things, we're going to be informed and make wise decisions in relation to sexual and reproductive health. The third point, let us smash stigma. Being curious about our bodies is something that is not dirty. When we're asking questions about our bodies, we shouldn't feel ashamed. Let us feel free to ask such questions because we're coming to know about ourselves. Let us destroy myths, taboos, and let not silence hold us back. Because sexual and reproductive health is something that promotes self-respect. And then the last point that we're going to talk about are periods. You see, periods shouldn't prevent a woman or a lady from undergoing normal type of life. If someone shouldn't feel ashamed because of their periods. And so if we promote a safe environment in which periods or menstruation is regarded as something normal, we're promoting a better health life in relation to sexual and reproductive health. The sixth point, rather, pardon me, the fifth point is let us push for comprehensive sexuality education. We have the right to receive education about our bodies, about consent, about relationships, contraception, and protection in a respectful and age-appropriate manner. This can be achieved through podcasts, online webinars, or among us as students, creating a free platform where each and every one of us can talk about sexuality and reproductive topics. And then the last but not the least point I would like to bring to your attention is that men, all of us were involved in this fight, in this promotion for better sexual and reproductive health. It is just not a woman's issue, it is a human issue. So brothers, friends, let us speak up for consent, let us challenge toxic masculinity, let us support safe sex, and let us respect women's choices in concerning sexuality and their bodies. And so, ladies and gentlemen, what can we take from this presentation? Sexual and reproductive health, it is vital for our health and it can empower us even as a youth population. Knowledge empowers us. Silence is what endangers us. Let us protect ourselves and we're going to protect our future. Periods are natural. Let us not put shame to them. And the change starts with each and every one of us in promoting better sexual and reproductive health from now on. Thank you so much for your attention, ladies and gentlemen.
Thank you very much, Kondwani, for that presentation on sexual and reproductive health. I think it's something that is really overlooked. You know, we're looking at the societies that we come from to ask certain questions about these things. It's seen as a taboo, and it is our job now, you know, as the youth, as future parents, to know these things, to know when a person starts, you know, asking questions about these things, we should be able to actually communicate the right information, not them going out there or us going out there being misinformed, in short. And then, you know, we have all these bizarre kind of ideas. So Thank you very much, Kondwani, for that presentation. So I'd like to check again if Dr. Kwivisa is with us. Are you here with us?
I'm around. Thank you very much. Maybe we can give it a try.
All right, fantastic. Donc, we are going to go ahead with you with talking about nutrition and healthy living, something that we need to look at, as students. I think it's something that we neglect, and it somehow is linked to what Dr. Lubeta talked about. These are things that we neglect as students, so we're eager to hear what you prepared for us. Donc, Dr. Kwivisa.
Thank you very much. And I don't know how old the boy was the first time I came around. So now the fellow speakers and the audience at large, something about nutrition that were on the lineup today. Nutrition is very important daily basis. Without food, you will basically die. The title for my presentation is promoting that. So it's basically was to be able to get the most out. We'll go to the intro. So nutrition is essential for maintaining health and prolonging life. And my presentation is basically going to define nutrition and its components and also explore global differences in dietary and in that some of those organization recommendations for better nutrition. So what is nutrition? So definition of nutrition is basically refers to the intake of food necessary for growth, energy, and health. So basically, this is what we get from food. So it's not just about food being delicious and everything. The actual things that we look for we look for in the food are the nutrients, and the nutrients help us with growth, giving us energy, and also maintaining our health by repairing our tissues when they are damaged, etc. So the nutrients components, in fact, are divided into two. So we have the macronutrients, which are the carbohydrates, the proteins, the fats, and the micronutrients, which are smaller nutrients like vitamins and minerals. So the next slide will show a pyramid. I think this is a very famous pyramid that shows us what we should focus on in terms of the food we eat.
Dr. Kwivisa seems to be experiencing some network issues. We'll just see if you'll be able to come back on shortly. Okay, it seems like we have lost Dr. Kwewisa. I'm trying to contact him, but the network issue really seems to be a big problem. So I think due to the interest of time, we will see if we'll be able to have him back to finish his presentation. But in the meantime, I think we are going to go to our sixth and final speaker for the evening before we have a certain speech. So we are going to move on to our sixth speaker, who is actually going to talk about another issue that affects us, the youths, as students, and this is something that we neglect. You know, we grow up in societies where these things are looked at as, I mean, we don't have these problems. What do you mean you're having such a problem? Ladies and gentlemen, the next speaker is going to talk about mental health with a focus on stress management. We are going to invite to the floor Charlie Fumbani, who is actually a fifth-year medical student studying in Rabat. Donc, Fumbani, we're listening. Fumbani, are you speaking? Perhaps your mic is muted or something.
Good evening, everyone. I hope I'm audible enough. Am I?
Yes, very clear.
Thank you so much. So, as has been indicated, my name is Fumbani Charlie. I'm a student in Rabat at the Faculty of Medicine and Pharmacy. And so today I'm going to talk about a topic, as the host has indicated, a topic that is very, very important, and it is sadly very, very neglected in our time. I don't know if it's because we do not have a lot of information about it, or maybe there are other reasons, but I want to believe the fact that we do not have a lot of information about it contributes to the problem. And so this presentation is to help us get a little bit of information about this topic so that we are able to see certain things and be able to act accordingly. So my focus is specifically going to be a lot more on stress, but we're also going to look at the mental health aspect of things as we proceed with the presentation. So this past week, as I was scrolling through Facebook, I came across this article that was put out by Diamond TV, and it reads as I quote, Chainama Hills Hospital has recorded approximately 10,000 new patients in the first quarter of this year, with 75% of those being youths. And that in itself indicates that we have about 7,500 of those cases that were recorded in the first quarter of this year being youths. And this only counts for the cases that have been recorded or that have been reported to the hospital. And if you think about it, a lot of these cases go unreported. And so that just gives us a picture of how grave or how serious this problem is in our society. So as we proceed with our presentation, this is a plan that we are going to follow. And I hope and trust that at the end of it, we are going to have learned one or two things. Now, brief purposes of this presentation are to raise awareness about this important topic called mental health, and in particular, stress. Also, it is here to help us share some coping strategies that we can use in the face of stress, in the face of stress and or mental health issues. Okay, so this presentation also is here to encourage us live healthily as students, as has been indicated by previous speakers. Now, what is mental health, you might want to ask? So as was defined by the previous speaker who talked about health not only being the absence of diseases or ailments, mental health, according to the World Health Organization, is defined as a state of well-being that permits one to realize their potential or to thrive, also to cope with life's challenges which come on a daily basis, also to help one work successfully and productively, and also it is this type of well-being that permits one to be able to contribute to the community positively. Okay, so that is basically what mental health is. Now, according to a research that was carried out by the World Health Organization, it it indicates that 4 out of 10 principal causes of disability and incapacitation globally are linked to mental health to mental health issues. And so if you look at this here, it actually shows us that of these 10, 4 of these are linked to mental health problems. And so that is just how serious this problem is, because it can bring about disability in different areas of our lives and also incapacitation in the long run. What are some of the risk factors that are associated with mental health? Like I said, we are going to look at the global picture of mental health, and then we'll go into stress, which is what we are going to focus on. So some lifestyle habits such as sleep deprivation, which is one of the things that is very common in our community or in our lives as students, because of the fact that we have school and a lot of things to do relating to school and our youthful lives. We a lot of times don't sleep enough, or we do not sleep at all in most cases. Other things that can predispose us to mental health problems include addictive behaviors such as substance abuse, which include alcohol, as was talked about by Dr. Felicity, I think, and also cannabis use. Other things can include racial discrimination or migrant status, the famous mon ami. For some people, it can actually put them in a place where they get to start experiencing things relating to mental health issues. Other things that can predispose us to mental health problems include financial constraints or financial insecurities, where, for example, a person has got loans, outstanding loans, or they've got problems with their finances. That in itself is able to put someone in a place where their mental health is compromised. So that is the global picture of mental health and what we might need to know because of time, of course. Now, what is stress, which is what interests us today in this presentation? So stress is defined as the body's natural response to any particular demand or challenge, which often is referred to as a stressor. So when you look at stress, it is the body's natural response to the demands that are coming, for example, in life. So that thing that is causing for the body to respond to that demand is what is called a stressor. This stressor could be a positive one. For example, finding a new job, someone starts a new job, that could put them in a place because they are expected to perform in a certain way, so it can stress them in a certain way. It can also be negative, where, for example, someone has got continuous problems, maybe academic problems, financial problems, and things in those lines. That can be what we call stress. Now, stress is divided into two types. So we have what we call acute stress, and then we have what we call chronic stress. So acute stress, from the name itself, this is a short-term form of stress or short-term type of stress that arises from specific events or situations. It can be beneficial in that it can help us to meet challenges or deadlines. So like I said, for example, someone starts a new job, the type of stress that they're going to be experiencing in that period, because acute stress is situation specific, meaning it only comes up with respect to particular situations. The moment the situation subsides, also the stress gets to go away. So that is about the acute stress. On the other hand, we have what we call chronic stress. So this type of stress is the long-term form of stress or type of stress that persists over time or for longer periods due to ongoing pressures like financial difficulties or an unhealthy work environment. So these two are some of the factors that can put someone in a place where their stress becomes chronic. Chronic stress can have serious negative effects on both our physical and our mental health. Remember what we said, health or mental health in general does not only mean the absence of diseases. It encompasses everything that our lives or our mental health revolves around. So chronic stress is the one that is able to have negative effects on both our physical and our mental health. Now, how does stress and mental health compare? So these two, oftentimes they are confused to be the same thing or to be one or the other. Okay, so we'll try to just differentiate them so that we're able to use them and we're able to understand them as they are. So just like we said, it's typically short-term and situation-specific, like we said. So it comes up with respect to particular situations. Okay, once the stressor is removed, the stress usually subsides. However, the first part of this part of stress is talking about acute stress in most cases. But when we talk about chronic stress, this is a type of stress that persists, like we said, for a period of time or for longer periods of time, and it can become detrimental to both our physical and our mental health. So it is about stress. It is always brought about by situations, okay? Mental health, on the other hand, it is a long-term state that can be influenced by a variety of factors. These include genetics, it includes life experiences, it includes biological conditions, and etc., etc. Now, our poor mental health can actually manifest as anxiety disorders, it can manifest as depression disorders, or it can manifest as irritability and things in those lines. Okay, these are some of the mental health disorders that will actually require professional treatment. In most cases, when you look at stress, it does not really need, especially the acute one, does not need any professional form of treatment and things in those lines. But when you talk about mental health, it needs and it requires professional treatment in order for it to be tackled in the way that it is supposed to be tackled. The other difference, or if we look at stress and how it gets to impact, how it gets to have an impact on mental health and vice versa, we'll discover that while stress itself is not a mental health disorder, so it is important for us to understand that stress in itself is not a mental health disorder. Chronic or severe stress is what can contribute to the development of mental health disorders. So it is like the way, for example, HIV behaves. When it gets into the body, it gets to affect the immune system, and then it sort of leaves the door open for other minor infections or any form of infections to get into the body, because the gate of the body is sort of compromised. So it's the same way that stress behaves. It just gets to affect the way that the body is supposed to function in terms of protecting itself, so much that other real mental health disorders, things like depression disorders, anxiety disorders, etc., gets to get into the body now and cause problems. For example, ongoing academic stress can lead to anxiety, or chronic work-related stress can contribute to depression. So stress in itself is not a mental health disorder. What impact does mental health have on stress? So our poor mental health, or a poor mental health state, can make it harder to manage stress, because you understand that stress is a day-to-day thing. Like, this is something that we live with on a daily basis. So if your mental health is compromised, it means that you are going to have a lot of problems. You're going to find it harder, you're going to find it difficult to manage or to cope with daily stresses that get to come your way. Okay? For instance, someone with anxiety may find everyday challenges more stressful than someone with good mental health. Okay? Mental health conditions can amplify the effects of stress, making it more difficult to cope with. So that is basically what the two gets to compare in terms of the impacts that they get to have on each other. Now, what are some of the causes of stress? So stress can be caused by a variety of factors, or by a variety of causes, but we're just going to cite a few. And these include things to do with academic pressures. In school, we're students, and so we understand what academic pressure means. If you're consistently having that pressure in school, it can predispose you to being stressful over time, which is going to start as acute stress, and then over time, if the stressor stays on for longer periods, then it becomes chronic stress, and then gets to other things and complicate your mental health. Other things may include health issues. For example, you have been diagnosed with a chronic disease. That in itself is going to stress you, and then it's going to lead to other things. Social challenges, such as moving from Zambia, for example, as a French student, you come to Morocco, you have to adapt, you are meeting new people, you are living in a new environment and things like that. That can also put you in a place where you are stressed. Future uncertainties, for example, you're finished school, you're graduated, you do not know what route to take. That can put you in a place where you're stressed, and if it is not well managed in the acute state, it can move and progress into the chronic and then complicate itself into other things. Financial pressures also fall under some of the causes that can bring about stress. The other things include time management, which is something that we can relate to a lot as students. The semester is almost ending, if not already ended for some people who have done exams. But yeah, so if you, for example, I haven't been studying from the beginning of the semester, now exams are here, I may find it harder to manage the stress that is going to come, or the pressure that is going to come with the exams and things like that. So time management also can cause, or can predispose us, can bring about stress in our lives. Now, what impact, or what are the impacts that stress gets to have on students? So on the physical aspect of things, you're going to be experiencing fatigue for the most part. Okay, for the most part of the day, you find that you are ever fatigued, you are ever tired. You're going to be experiencing things like sleep problems, where you'll be sleeping a lot more than you do, or you are going to be finding it harder to find sleep at all. Those are some of the impacts that it's going to have on the physical aspect of things. On the mental and emotional health, it can predispose you, or it can bring about anxiety on your day-to-day life. It can also predispose you to depression, or it can lead you into depression. It can bring about burnout, where you are ever exhausted. Okay, it can also bring about irritability, where even a small thing, a simple greeting can irritate you and you start shouting and things like that. Okay, on the academic front, you are going to have a decreased concentration in class. You'll find it harder to like pay attention, to just grasp even the simplest of concepts, things like that. Okay, that can be as a result of stress, which can lead to low grades in tests, and it can also bring about tests and exam anxiety, etc., etc. On the behavioral aspect of things, it can bring about behavioral changes. This includes things like isolation of oneself, and these are some of the things that we actually have to be observant about, especially in our friends' lives or even in ourselves. Although it's kind of hard to like see them in ourselves, it is, I think, much easier to see in other people that we are staying with or people that we are mingling with. Okay, so you will see things like isolating oneself, unhealthy coping mechanisms such as substance abuse, or other harmful behaviors, which can include things like gambling, things like video games for longer periods of time, and necessarily you know that you're supposed to study or you're supposed to be doing things that are productive, but you find yourself that you are just spending a lot of time in front of the screen and things like that. Okay, it can also bring about procrastination. The other thing that it can bring about is what is called avoidance behavior. So this avoidance behavior is a situation where you understand what is bringing about the stress, and so you are avoiding what is bringing about the stress, and in the end you find that you're avoiding the work that you're supposed to do. Okay, those are some of the impacts that it gets to have, and those, I think, they cover a lot of things that we're going to see even in the signs and symptoms. And so I think I'm just going to move past this one. Yeah, so these are some of the symptoms and the signs that we can see in someone that is stressed. What are some of the coping techniques that we can use as we navigate this phase of our lives? On the physical aspect of things, you might want to consider regular exercises, which is something that Dr. Felicity talked about. She emphasized so much the importance, of course, understanding the motive as to why you want to do that. This is so important because physical activity it helps the body to release hormones that are natural boosters, which are going to be very important to help you to be out of that place where you are ever stressed. Okay, progressive muscle relaxation are things that you would want also to consider. And most importantly, you want to have adequate sleep. It is recommended that you sleep, like Dr. Felicity indicated, for about 8 hours as a young person or as a student. On the mental health aspect of things, on the mental and emotional, in terms of coping techniques, you want to do some mindful activities or meditation. You're just sitting and then you're thinking about some positive things, or just meditating about life. It can help you be away from stressors and stress in the end. Gratitude journaling, which is something that I personally do when I'm stressed. I get to just sit down and write things that I'm grateful for, and I think that helps me to be out of those kind of situations. On the behavioral aspect of things, you want to look at your time management. If you know that what you have is likely to put you in a place, now that we have learned about stress, we know what can bring about stress, time management should be something that we want to consider. If you know that the semester is starting, you want to start things a bit earlier so that you don't run into problems. The other thing that you want to consider is healthy boundaries, setting healthy boundaries where you know a yes is a yes and a no is a no. Okay, set also realistic goals so that you don't put yourself in a place where you are disturbed in that situation. Also, lifestyle behaviors, as Dr. Kwibisa was going to or is going to indicate, things to do with your eating habits, hydration, limiting or avoiding substance abuse, as those things are very detrimental to our health and our mental health in general. And most importantly, you want to seek professional help, because a lot of times on your own, you're not able to do it. And so it is important that you find people that you can confide in. This could be a therapist or a counselor, or even support groups. You can share it with your family, with your friends, people that you can trust. The church, if you are a Christian, I don't know for other people in other religions, but in the end, just find professional help, people that can help you and support you as you navigate this phase. And in conclusion, it is important for us to understand that stress is very natural and very inevitable in our lives, but it is important for us to manage it very, very well. It is not a mental health. It is important for us to understand that it is not a mental health in itself, but how we handle it and how we get to navigate through it gets to affect our mental health overall. And that is it for my presentation. Thank you so much for your attention.
Well, thank you very much. Thank you very much, Fumbani, for that presentation on stress and mental health. You know, we have understood that stress in itself is a natural response and it could be positive or negative. However, prolonged stress actually becomes an issue and it can affect our mental health. So let us guard our mental health closely. Let us avoid, overstressing because this is something that will affect our whole being and our whole existence, if I can put it that way. Before we try to, check with Dr. Kwibisa again, and before we go into the Q&A, I think let me just take this moment to, so that we can receive a very special address. Allow me to, because this is actually a privilege, and so allow me to introduce our guest of honor who is now in our presence, His Excellency Mr. Eliphas Chinyonga, who is actually Zambia's ambassador to Morocco. And so, Your Excellency, we are truly honored by your presence among us during this symposium. And please take the floor with a few words here and there.
Thank you so much, Mr. Master of Ceremony. I think I see the name Kennedy Chama. Just to be sure, am I audible?
Yes, sir, very much audible.
Thank you so much. Let me just start by conveying my profound apologies that I joined the meeting late, and the reality on the ground is that I have auditors in my office. I think you will all understand what that means. Having said that, I'll go into my short speech, and it reads, distinguished health experts and all panelists, esteemed members of the SASAM executive, dear Zambian students, invited guests, ladies and gentlemen, good evening to you all. It's both an honor and a privilege for me to speak before you today as guest of honor at this important symposium organized by our resourceful Zambian students here in Morocco. Let me begin by commending the ZASAM executive for this visionary initiative under a very timely and apt theme, striving together, staying healthy together. It's often said that our health is our most important precious gift, whose integrity we should try by all means possible to preserve. This is so because everything we do revolves around whether or not we are in good health. Tonight's symposium represents more than just another academic event or indeed any routine gathering. It embodies powerful principles, among which is the power that lies in our collective responsibility, especially towards health and well-being. I implore and challenge all of you participants in tonight's program to become health ambassadors by being good examples in terms of how you live health-wise in your communities, schools, places of work, etc., and all around what you do. I also implore you to prioritize all forms of well-being, for that remains very important for your personal growth and also for our national development. As an embassy and government, we remain very much committed to support such programs, and that they are raising awareness, especially within the Zambian student community, for our young people within the Kingdom of Morocco. To my dear Zambian scholars, you represent our nation's best hope. The discipline that you show in maintaining your health today directly impacts the energy and ideas you bring home tomorrow. Remember the wisdom of our Ubuntu philosophy. A person is a person through the other person. Your well-being is our collective well-being. In the words of the first Zambian president, Dr. Kaunda, the power of unity is stronger than any obstacle. Let this symposium ignite partnerships, and outlive tonight. Because if and when we strive together, we stay healthy together. As is also in the words of our national motto, One Zambia, One Nation. Let us now say, one health, one future. Thank you so much for your kind attention. And I have been following the deliberation since I joined a short while, but I'll seek the chair's permission that maybe when the Q&A question comes up, I can be allowed to withdraw so that we can have an unhindered engagement between the peers. Chair, I thank you so much. Thank you all for your kind attention.
Thank you very much, Your Excellency, and thank you for your reiteration of reminding us that as the embassy, you are here for us, supporting such initiatives so that even when we go back to our motherland, Mother Zambia, we go fully equipped to serve the nation as we promised as we were living. So thank you very much once again. And of course, as you have asked, you are allowed to excuse yourself. Thank you very much.
Thank you. I'll wait for the Q&A session.
Okay, sure thing. So we are going to try Dr. Kwivisa once again. So I don't know, are you with us? Dr. Kwivisa?
Let us give it one more and see if it will work out. I'm just going to begin from the beginning. I know that the moments that have passed, you might have even forgotten what I said at the beginning. My apologies for the network, for the screen to be shared. I just want to make this remark. When you see or you hear people in Zambia saying, shortly they have gone to the mall. It's not to buy food or to buy clothes.
And it seems we have lost him again. The network is really, he has something oh, he's back.
Okay. The network is really on and off. So I'm unable to see my screen. I don't know whether I'm audible and whether others can see the screen.
You are more or less audible, but the screen we can see. So try to go ahead. We'll see how it will go this time.
Okay. So I was from the beginning, and hello?
Are you still with us? We are really struggling to get you.
Yeah. I'm here.
Okay.
I'm here. I can't see my screen. If you can kindly share my screen so that I can try to close because the network is really very bad here.
We are actually. You still cannot see it because we are sharing it already.
Okay, I can't see it, but more than fair enough. I'll be giving signal if we need to go next. So am I audible to continue?
Yes, please go ahead.
Yeah, so my presentation is introduction and health. Subtitle promoting life health through that. And just through the nutrition is essential for mental health and prolonged and presentation with nutrition.
We seem to have lost him again, and well, we're not sure if this network issue will really get resolved. So it is sad that Dr. Kwebisa might ultimately not manage to, give his presentation, which is something we really needed. Because, nutrition, most of these topics that we have talked about, they are investments for the future. We do this while we're still young, so that our future us is actually going to thank us if we practice healthy living now, healthy diets, and he seems to be back. Let's hear again. Dr. Kwebisa?
I'm back, yes, but I really think that if the network cuts, just you should go ahead and do the presentation so that people are not kept waiting for the network, because it's been unstable for a long time. So I think that as I was saying, in our presentation, we're going to basically define nutrition and its components, and also explore. And the definition of nutrition, basically nutrition refers to the intake of food necessary for growth, energy, and health. And this it involves micronutrients and macronutrients and micronutrients. Basically, macronutrients are carbohydrates, proteins, fats, and the micronutrients are vitamins and minerals. And I'll give you a visual representation in the next slide. A visual representation that should be able to guide you to pick, your foods in terms of their importance on the body. So the grains should be taken as the most. As you can see, just on the bottom, we have all sorts of grains, types of grains found in different places of the world. So should be taken most. As we go towards the apex of the pyramid, we find dairy products and proteins such as meat, fish, eggs, and other alternatives. And for the dairy products, and
It seems like we have lost him again. But if I heard him right, he was like, we just continue the presentation because I have gone through it and it seems like what he has to share is actually something that it's an eye opener, something that will help us, even as we walk into the future. So I will take up the role of presenter, even as I am host. So maybe Fumbani, we can go ahead. Now you can just continue it after the pyramid. Okay, so the following that we're going to see, these are just statistics from different parts of the world and how nutrition actually affects these things, and we will compare to a particular case, which is our setting, Africa, and how we really need to take this seriously. So if we look at nutrition and life expectancy in Europe, for example, the average life expectancy is 80 plus years. And you find that if you are taking healthy diets, this reduces heart diseases and other issues by 25%. And it is actually recommended that we take Mediterranean diets. Most European countries and even this Maghreb region, they actually emphasize on taking a Mediterranean diet, which is rich in fruits, vegetables, olive oil, which is actually linked to lower mortality. So we can go on. If we look at America, for example, with an average life expectancy of 77 years, we find that obesity, which is linked to not following proper diets, actually affects like 36% of adults, and this is mainly linked to processed foods. As we know, in the Americas, they like a lot of processed foods, which is actually contraindicated. We are advised not to take a lot of processed foods. And so improved access to fresh produce can actually add 5 years to your life expectancy. 5 years is a lot. Some of us have been in Morocco for 5 years, but anyway, let us move on. If we look at Australia, for example, with an average life expectancy of 83, their diet mainly has an emphasis on lean protein and fresh produce. And low obesity rates actually contribute to reduced chronic diseases. When you talk about obesity, it's a hot topic on its own, and this is something we can look at this another day. But basically, let us try to strive for a good diet, and we'll have a longer life. We can move on. If we come to Africa, unfortunately, with a life expectancy reduced to an average of around 63 years, and this is attributed to many factors, amongst which is malnutrition, which affects around 20% of the population if we look at it from a general point of view. And so increased access to food and education could boost our health outcome and our life expectancy, as we have seen from other regions of the world who have, prioritized certain kinds of diets that actually contribute to life expectancy. Yes, next slide. Okay, so some of the issues, some of the illnesses that are caused by poor nutrition, we have obesity, which affects around 13% of the global population. A heart disease, which is linked to high fats and sugar intakes. We're actually advised to reduce on our fat intakes and our sugary intakes. It is detrimental to our health. And these are things linked to overnutrition. When we look at things like undernutrition, we have anemia, which affects about 30% of women worldwide. When you have anemia, your blood is unable to adequately supply enough oxygen to the rest of the body, and it can have negative impacts on the body. And stunted growth is another thing that is linked to undernutrition, and with 22% of children affected globally. And so quickly, we're going to go into good eating habits. We are advised to diversify your diets to include all food groups. Focus on whole grains, fruits, and vegetables. And as I already mentioned, reduce the intake of processed and sugary foods. Next slide. Stay hydrated. We always hear this. Drink at least 8 glasses of water. Drink at least 2 liters of water. This isn't just, it's not just from without. Your body actually needs that water. Stay hydrated. And so avoid overeating amongst some of the good eating habits that we need, and maintain a consistent meal timing for optimal digestion. Our stomachs need certain time to digest food, and we need to follow certain kind of recommendations. And so according to the World Health Organization recommendations, we are advised to consume at least 400 grams of fruits and vegetables daily. If I was to ask who ate vegetables in their last meal, I think a vast majority of us did not even have vegetables in their meal. So we are advised to, eat at least 400 grams of fruits and vegetables. Keep free sugars below 10% of your total energy intake. And last but not the least, limit total fat intake to less than 30% of daily energy intake. Another issue we need to look at is to reduce the salt intake, to limit it to like 5 grams daily. 5 grams can be like a teaspoon. Now, while that might seem like something limited, but over intake of salt is actually detrimental to our health, our cardiovascular system, our heart gets affected. So we're advised to reduce on the intake of salt and promote breastfeeding for the first 6 months for optimal child health, because this allows the child to actually receive the right nourishment that they need. And finally, ensure access to clean water and sanitation to improve nutrition. And so I think we can just go to the last slide. Voila. The last slide is a call for action. You see, as I already mentioned, everything we're talking about in nutrition is an investment for the future. It is about our health and our longevity, even as we live in our different communities. And so as individuals, adopt balanced diets and educate others. And in larger settings like governments, and we'll actually implement policies for food security and public health. And so, ladies and gentlemen, together we can build a healthier world. Thank you very much. Thank you very much, Kennedy, anyway, I wasn't the presenter, but at least I tried to, share the message that was presented, that was prepared for us by Dr. Kwibisa. I hope you got something from it. I am informed we are left with 2 minutes of this scheduled meeting, but we are supposed to do the Q&A rapidly. So perhaps as soon as this cuts, we will create a link rapidly. And so we have arrived to the question and answer session. So if there are any people who have questions concerning the different topics that we have presented, please feel free. You can either raise your hands, open your mic, and ask your question to any of the panelists. This is the moment if we have any questions. Unless, of course, the presentations were just, spot on. We understood everything and the essentials were communicated to us. Okay, I do not see any hands being raised, but anyway, in the time being, perhaps, okay, so we already have a link for when this cuts, so that we can just finish our Q&A. Since people aren't asking questions, perhaps I'm going to ask the panelists to clarify on certain things, or maybe vehiculate a certain message to us. And so I'll ask Dr. Lubeta Felicity, please, when you shared on importance of physical fitness and non-sedentary living, I have a question. How does prolonged sitting or sedentary lifestyle actually affect our body, and how soon do the effects of such start showing up? Like, will we see the effects now, or maybe it's something that happens later on in life? Dr. Lubeta.
Now. Oh, thank you so much for that question. It's a very good question. So the effects do come gradually, and that's why most people don't see the importance of exercising. Number one, the disadvantages is that if you don't exercise and live a sedentary lifestyle, you don't promote blood circulation in your body. and this can lead to stasis of the blood. It's basically the blood not flowing easily, and that can cause effects like cardiovascular diseases. When there's stasis, it may cause settling of fat deposits in the blood, and that can destroy several organs in the body. Just like I mentioned how exercise can improve those organs, the opposite happens, like destroying kidneys, because kidneys have narrow blood vessels, for instance, and if those blocked, if those arteries are blocked, that can lead to several kidney complications like kidney failure. When it comes to the heart, you would have coronary heart issues like heart attacks due to a blockage in the coronary artery leading to your heart muscles. So that's going just in the depth of medicine, and for your brain, it can reduce your cognitive function and reducing focus, memory retention, and so many things. But because these effects are so gradual, you begin to see them later in your in life, like maybe when you reach towards your 40s or sometimes even earlier, because the things we consume too, because that also plays a major role in connection with exercise, like that was talked about nutrition in the other presentation. They come together to form a main strategy for your physical fitness. So I would encourage people to constantly exercise and do it for the long run, because we may not see the effects now, and we may feel strong and energetic and young because our bodies are ready to revamp in case of any damage. But in the long run, you begin to see most of these cardiovascular issues, lung issues, kidney issues that might come. Yeah, I don't know if there's any questions or if I've answered the question.
Thank you very much. You have indeed answered the question. It's a whole melange of everything that comes together, and ultimately, in the long run, we see the effects. So there's a question in the chat. I believe this is addressed to Dr. Kahango Prince. It says, it's seeking clarification. Among the most abused things is vaping, with the sweet-smelling flavors which come in variety. I believe behind that lies a time-ticking bomb waiting to explode. Would appreciate if some awareness would be shared. So to more like add to this question and maybe rephrase it a little bit, a lot of people who smoke these days, perhaps they're trying to stop smoking by using, oh, sorry, I mixed the vapors with the other vaping. Okay, anyway, the vaping. Dr. Kahangu, do you have any comment on this?
I would say that the risks are pretty much the same, and the flavors that are put in the vaping substances are chemicals. And the major risk is pretty much the same as normal tobacco or any other substance. But one thing I might highlight is the presence of a molecule called diacetyl, which is a chemical that is found in those flavorings. And it causes like inflammation of the bronchioles by causing a condition called bronchiolitis. So there's still a risk. And one thing, I don't know if it's the same in Morocco, because personally I've never smoked, but here in France you find that if you're going to buy like whatever these smoking substances, either it's tobacco or the same substance that you're talking about, you see that they put images of the diseases that somebody is prone to have when they are taking such substances. So I think that could be one of the best things to do, but in less developed countries, we don't always find that. Just to summarize, the risk is still there. So, for example, the inflammation of the bronchioles. Yeah. So I don't know if that was clear or you want me to explain more.
I think it was loud and clear, but if the person who asked the questions didn't really get the answer they need, it's clear. They have given us. All right, so before we move on to a question that has been addressed to Kondwani, I have a question for Dr. Mtali Dilax concerning dental health care. You know, I think I had mentioned this even earlier on. We only visit the dentist maybe when we have a toothache that we can no longer suppress by using paracetamol, which goes into Dr. Kahango's presentation of how we misuse certain drugs by just using it. It's not even prescribed. But then I have a question for you, Dr. Mtali. How often should we actually go for a checkup with respect to our dental health?
Okay, thank you for that. So normally, each person needs to like go through the dental checkup. Now, what happens is that it depends with what they found in the initial assessment, in the initial clinical exam. So what we do is, first of all, we're going to analyze everything, and then from that, we can now conclude to say, with the state of your mouth, you need at least you need to visit the dentist once in every 6 months or once per year. Or sometimes, depending on how or the things we find, it can be 3 times in 6 months or 3 times in a month. It depends. So the first thing that we do is we're going to analyze the general state of the mouth, and then from there, you're supposed to now go for the checkups. So if you've never been to a dentist, like for really like the checkups themselves, just go for one checkup, and then from there, they are going to give you another rendezvous for how long we are supposed to be at least making these follow-ups. Yeah.
All right, thank you very much. So I guess the first step is actually going to the dentist and then knowing if you need, those rendezvous. And also, just before you get off, Dr. Mtale, there's a question for you that says, which one is better, water or string floss? What's the ideal dental routine? Dr. Mtale?
Okay. Which one is better? Normally the thing is you can use the fil dentaire, which is, I don't know how it's called. Yes, so the fil dentaire itself. Now the problem with that is that you need to be taught, and that goes back to the fact that you still need to visit a dentist because they will teach you how to do it, so that you do not get or you do not tamper with the gums, and that will bring about gum irritation and other things. So that one is good because it can actually, because you are applying force, and that's the the mechanical aspect of it that will uh, ensure that we remove the certain food debris that we have. So that one is better. And then, of course, it's supposed to be complemented with the actual brushing. Okay. And what's the ideal dental routine? So normally, if you can do twice a day, it's much better. The first and most important, actually, it's to brush your teeth before going to bed. In the morning, yeah, well, you can, but the most important, it's brushing your teeth before going to bed because of what really happens at night. Our the flow of saliva in our mouth reduces. The immune system is not at its optimal performance. So a lot of things really happens at night. So it's better you brush your teeth so that you reduce a lot of pathogens moving around unnecessarily in your mouth. But of course, you brush your teeth in the morning as usual, but the most important is before bed. And after you brush your teeth before going to bed, you're not supposed to eat extra foods afterwards because that's it. It's like you're done, that's it, and you go to bed.
All right, thank you very much. Thank you very much. And so I'll quickly move on to the topic of sexual and reproductive health. Kondwani, I hope you're still here with us. There's a question addressed to you which says, what are some of the early symptoms of some common STIs?
Thank you so much, moderator. I hope you can get me clearly.
Yes, we can.
Yeah. I appreciate this question, and we have to be aware of some common symptoms that can be manifest in relation to sexually transmitted infections that are common. But one thing that I can advise everyone is that not all sexually transmitted infections can have particular symptoms. And so if you're a youth who is, for example, active more sexually, if you're sexually active, and then you notice some red flags, I can call them. Some of these worrying symptoms that when you have, you should be alarmed or you should see a doctor. For example, if you have pain in the vaginal area, if you have itching, discomfort in the vaginal area, for example, if you have what we call a shank, which is a painless sore in the genital area. So when you see such things, you need to consult a doctor because that can be manifestation of early stage syphilis, for example. Other symptoms that we can talk about are, let's say, when you are urinating or you are having sexual intercourse and then you are having pain during urination or having sexual intercourse, that should be alarming also. And then when you have regular itching or irritation of the vaginal area, when you have discharge, which is yellowish, greenish, or abnormal discharge that comes from the uh, genital area, you need to consult and reach out to a doctor. Yeah, those are just some of the common things or symptoms. But of course, as I said, some symptoms, some sexually transmitted infections cannot have these symptoms. They can be acute for a long time. And it is for this reason we emphasize to say if someone is sexually active, they need to do regular checkups to quickly detect some of these diseases at an early stage. I hope that answers the question. Thank you.
Thank you very much. You have indeed given us some of the early stage signs because some of these sexually transmitted infections, if you ignore the early signs in its early stages, when it advances, those are serious complications. And so thank you very much, Kondwani, for that. We seem to be having quite a number of questions for Dr. Mtali, but before we try to answer that, I have a question for Fumbani on the l'histoire de mental health with respect to stress. What are some of the early signs of stress or burnout that students often overlook? What are those things that we can look out for and act upon them immediately we see them?
Okay, thank you so much for that question, Mr. Moderator. So as I indicated, I think that was one of the slides that I just bypassed because of time. So some of the symptoms, the early symptoms, just like Kondwan is from saying, some of these things may not really show the serious symptoms or may not show the same symptoms in every other person. So one person may present in a different way, another person may also present in a different way. But some of the typical signs and symptoms that you are likely to see are things like persistent headaches, you are beginning to have problems with your concentration, you are ever fatigued, you're having problems with your sleep, you find that your sleeping pattern just gets disturbed, you're sleeping a lot more than you usually do, or you are sleeping a lot less than you usually do. Other times you find that you are finding it hard to even find sleep at all, regardless of the fact that maybe you are tired and things like that, you are just, it's just hard for you to find sleep. Other things that you may see, okay, the list is non-exhaustible, but yeah, those are some of the symptoms. That also things to do with your appetite. You find that your appetite gets disturbed, especially when it's advancing. Yeah, you find that some other times you would find that you are eating a lot more than you usually do, the junk foods and things like that, or you are eating a lot less, your appetite just is disturbed and things like that. So yeah, added to that, there are other symptoms, but those are some of the typical signs and symptoms that we can see in someone that is having some level of stress. I hope that answers the question.
All right, thank you very much. And I'd just like to apologize, for keeping everybody longer than we actually planned. But maybe just to answer the last question, because I think the major thing here is that we wanted to transmit this knowledge to the general populace. It's not just for, us in the medical circle, speaking between ourselves, but we want to communicate to the general populace so that we can actually stay healthy together. And so maybe to just answer Nyanke's question, basically about ways to brush our teeth, I think Dr. Mtali did not speak about that. He said due to time. But if we really want this, I think we can schedule another time where we can just have, perhaps Zasam podcast can help us one of these evenings. We just start coming up with a topic for that evening and we just talk it to its length. Yeah. But I think this will be the last question for the evening for Dr. Mtali. In what order? I doubt if we even do most of these things, but in what order should we do the following? Brushing, flossing, tongue scraping, and mouthwash. And to add to it, are they all necessary? Dr. Mtale.
Okay. Well, because of time, I'm not really going to go into the details. Just I was looking at Nyanke's question. That's very, very important. I wish I was given an opportunity to explain, but Nyanke, you can look at, you can just search for modified brush technique type of brushing, the method of brushing teeth, modified brush technique. It will answer a lot of questions. Okay, and concerning Sadi's question, in what order? Well, there is no much but the main focus is not really on the order. You can floss, brush your teeth, but the most important is you cannot do the mouthwash alone. The mouthwash is a complementary thing, whereas the brushing and the flossing is optional, especially if you have access to certain zones where your toothbrush can reach. We usually use the flossing method if you have certain zones that you can't, the toothbrush can't reach. But usually, if you've got diastemas almost everywhere, then there is no need for you to use the flossing method. So yeah, so the using the toothbrush, very important. And on the last part, you need to do the tongue scraping, very, very important because a lot of things are actually harbored on the tongue. So it's very important that you scrape it to avoid bad breath and other things that may come with it. Mouthwash is complementary. It's not really mandatory to use it. Actually, you have to use it with caution because it might aggravate certain things. Yeah. So mouthwash complementary, just water itself is fine. Tongue scraping at the end, but brushing of your teeth, very key. Flossing only if you can treat certain zones where the toothbrush can reach. Thank you.
Thank you very much. And that brings us to the end of our 2025 ZASAM Health Symposium. Thank you, Dr. Mtale, and thank you to all our incredible speakers today. Each of you has reminded us that health is not one decision, but a lifetime of informed and united choices. To everyone who joined us tonight, your presence showed that together we can truly strive together and stay healthy together. We appreciate your engagement, your questions, and your commitment to personal and community well-being. Until next time, stay informed, stay active, and above all, stay healthy. Good night.